the Caregiver Connection podcast by Best Care, where we dive into new topics each week, drawing inspiration from our insightful and educational blog posts. We're committed to providing valuable information that impacts both home care clients and caregivers. Without further ado, let's jump into this week's episode. How to recognize and prevent elder abuse. The signs of elder abuse can be subtle at first. Withdrawn demeanor during family visits, unexplained bruises dismissed as simple falls, or unusual changes in bank accounts. Elder abuse is a growing concern in our country, with research showing that approximately 1 in 10 people aged 60 and older who live at home experience some form of elder abuse, neglect, or exploitation. Even more troubling, cases increased significantly during the COVID-19 pandemic, highlighting the vulnerability of our senior population. Elder abuse occurs in homes, care facilities, and communities across every demographic, affecting people of all socioeconomic groups, cultures, races, and ethnicities. But there's hope. By understanding the warning signs and knowing how to take action, we can protect our vulnerable seniors and ensure they receive the care and dignity they deserve. This comprehensive guide will walk you through the various types of abuse, help you recognize early warning signs, and provide practical steps for prevention and intervention. Most importantly, you'll learn exactly what to do if you suspect someone you love is at risk. What is considered elder abuse? Elder abuse takes several forms, and understanding the types of elder abuse helps in early detection and prevention. Elder abuse examples range from obvious physical harm to more subtle forms of exploitation. Physical abuse often manifests as unexplained bruises, burns, or broken bones, signs of restraint and/or delayed medical care. Emotional and psychological abuse typically appears through withdrawal from social activities, unusual depression or anxiety, and fear around specific caregivers. Financial elder abuse represents another significant concern, often occurring gradually through unexpected changes in bank accounts, missing personal belongings, or suspicious financial transactions. Elder financial abuse may deplete an older adult's life savings before detection. Recognizing the signs of elder abuse. Warning signs may be subtle at first, but typically become more apparent over time. Poor personal hygiene or unsafe living conditions often indicate neglect, while unexplained weight loss or malnutrition might suggest inadequate care. Isolation from friends and family, missed medical appointments, and unusual changes in behavior or mood can signal various forms of abuse. Unexplained financial transactions or sudden changes in banking patterns may also point to elder abuse. Prevention strategies and protective measures. Preventing elder abuse requires a proactive approach. Here are 4 things you can do to protect people that you love. Maintaining frequent contact with elderly loved ones helps you detect changes in behavior or living conditions. Regular oversight of financial accounts and transactions can prevent or quickly identify potential exploitation. Supporting caregivers also plays a crucial role in prevention. Providing respite care options and ensuring caregivers have adequate training and resources helps prevent burnout and reduces abuse risks. Educating yourself about elder abuse warning signs and sharing information with other family members creates a stronger, protective network around vulnerable seniors. What happens when you report elder abuse? If you suspect or confirm elder abuse, the Minnesota Adult Abuse Reporting Center provides a toll-free number, 1-844-880-1574, for you to call. This phone line is available 24 hours a day, 7 days a week. If this is an emergency or someone is in immediate danger, call 911. According to the Minnesota Department of Human Services, this is what happens after you make a report to the MAARC. All reports of suspected maltreatment received by MAARC are referred to the agencies responsible to respond. The agency responsible depends on the relationship between the vulnerable adult and the person alleged responsible. If there is an immediate social service need for the vulnerable adult, and if the report contains information which may also be criminal. Lead investigative agencies are County Adult Protective Services, Minnesota Department of Health, or Minnesota Department of Human Services. Reports are reviewed by the lead investigative agency to determine if emergency protective services are needed. Reports that include an alleged crime are also referred to law enforcement. Information contained in reports of suspected maltreatment of vulnerable adults made to MAARC is confidential under Minnesota law. MAARC cannot provide information about a report to anyone, including the reporter, once a report is completed. Once a report is referred to the agency responsible, different parts of the law cover how information in the report can be shared, but the identity of the reporter remains protected. Contact the county or state agency responsible for the report for questions about a completed report. Best Care is your trusted advocate in elder care. Best Care is committed to protecting seniors and supporting families and preventing elder abuse. Our experienced team is here to answer your questions about family caregiving and provide guidance in creating safe, nurturing care environments. Contact us today to learn how we can ensure your loved one's safety and well-being. If you find this podcast helpful, share this with a friend, leave a review, and don't forget to subscribe. Contact us today for expert guidance and support. Visit bestcaremn.com. Thanks for listening to the Caregiver Connection.